journey of battling cancer brings about many new emotions for patients and their loved ones. Fear of the unknown is probably one of the most difficult feelings to grasp.
But fortunately, in today's age of medical advancement and technology, cancer can best be endured with innovative new treatments, a positive attitude, healthy lifestyle, and especially support from loved ones as well as your team of caregivers. I'm Dr. Gerald Militello. My partners and I at the Hematology Oncology Clinic are here to give you care and support during your treatment and also throughout your recovery. Together with each patient, we make a plan to move forward using all the best diagnostic and treatment tools necessary to win the battle with cancer. In other words, chemotherapy, surgery, radiation, and/or a combination of any of these three. And today, I'd like to talk with you about your chemotherapy treatment and give you information that will be comforting and useful to have throughout your treatment.
The word chemotherapy is a bit daunting, but actually it was first used to describe any medicine used to treat a disease or ailment. Even aspirin was described as chemotherapy. But today, chemo is most often related to taking certain kinds of medications or drugs that treat cancer. And modern-day chemo drugs are truly miraculous and so successful that within the last decade, oncologists now tell patients that the diagnosis of cancer no longer means an end to life. Cancer is a group of abnormal cells that divide quickly and grow out of control. Each kind of cancer affects the body in different ways, and chemotherapy is one of the treatment tools that deliver drugs that work throughout the entire body. Surgery and radiation are other treatment tools that target more specific areas, and that's why in many cancer patients, we use a combination of these treatments to ensure the best chance of curing the cancer. Chemotherapy drugs can destroy or damage cancer cells that have metastasized or spread to parts of the body away from the original tumor or cancer cells. More than 100 chemo drugs have been studied and found to be highly successful along or in combination with other drugs. The combination effect is often more powerful and prevents you from becoming resistant to any one drug.
And today, many of our patients are offered opportunities to participate in clinical trials. These trials allow us to provide patients the most advanced therapies available. We encourage you to consider participating in clinical trials if the treatment is right for you.
After your diagnosis has been confirmed and it is determined that you will need to receive chemotherapy, you and your doctor will carefully determine your treatment regimen. Your team of caregivers will be with you every step of the way to take care of you and answer any questions you may have. But we also know that knowledge is power. Here are the ways in which a patient may receive his or her treatments. You might swallow a pill or take it in liquid form. In most cases, this can be done at home, following your doctor's instructions carefully. Chemo can be given as a shot, just like your flu shot, in your doctor's office, or a hospital, or at home. Most often, chemo is given right into the veins, either in the hand or the arm, with a tiny needle or plastic tube called a catheter. These treatments can last between 5 minutes to 24 hours. A pump device may be used to administer medications over a longer period of time. Metaports or Hickman catheters may be placed just under the skin and transport medication to the veins over extended periods of time. If you feel a burning sensation at the site of your IV port or catheter, please let your nurse know. Most chemotherapy can be done in an outpatient setting, scheduling appointments that best work for your lifestyle. Some patients take chemo once a day or once a week. Our treatment rooms have comfortable recliners and televisions. We also recommend bringing reading materials, laptops, or iPods to make the time pass quickly during your treatment. Each chemotherapy regimen is different, based upon the individuality of the patient and his or her situation. Therefore, side effects are impossible to predict and should never be expected. First, a positive attitude and a healthy diet will go a long way in managing potential side effects. Some chemo does make people feel sick. Your doctor will test your blood frequently to monitor your functioning and make adjustments in dosages as needed. Sometimes people need to adjust their lifestyles and work schedules to manage the side effects. Some need to receive chemo in the hospital for closer monitoring during treatment. Every person is different and will experience some or none of the following. Bone marrow changes. The bone marrow is this inner liquid of some of your bones that make red blood cells, white blood cells, and platelets. Red blood cells, which carry oxygen from the lungs to all parts of the body, may decrease in production during treatment and cause you to feel tired, short of breath, weak, and in some cases cause anemia. Anemia can cause your skin, mouth, and gums to look pale. White blood cells fight infection, and because chemo can lower your white blood cell count, your risk for getting sick from an infection is increased. It is recommended you are conscious of good hand hygiene, staying away from people who have infections or fevers, and wearing protective masks when in public places. Also, when your count is low, your doctor may have particular dietary recommendations, but continue eating both cooked and raw foods until your doctor tells you otherwise. Platelets help with forming blood clots to stop cuts or bruises from bleeding. Chemo can weaken your platelet production, which can lead to bleeding from the simplest of cuts or bruises, and can even cause your gums to bleed when brushing your teeth. If your platelet count is low, you should be cautious and avoid injury. Purchase a soft or foam toothbrush, and ask your nurse if flossing should be temporarily ceased. The good news is that new drugs called growth factors can be given intravenously or as injections to help bone marrow recover. Transfusions can also replace red blood cells and platelets. Hair loss. Cells in your hair can be affected by chemo, and hair loss may begin approximately 3 to 4 weeks after certain kinds of treatments begin. Many people choose to wear hats or scarves in the beginning stages of hair loss, and some choose to purchase, rent, or borrow wigs and say that having normal-looking hair lifts their spirits. Talk to your loved ones about what is most comfortable for you. Stomach, intestinal, and bowel discomfort. Cells in your stomach and intestines can be affected by chemo as well. To prepare for treatment, eat a light meal and drink plenty of fluids before treatment. If you're hungry after your treatment, eat a light meal such as soup, crackers, or toast. Avoid hot, spicy, fried, or greasy foods. Symptoms may begin 3 to 6 hours after some treatments, such as nausea, vomiting, or diarrhea. At the moment of feeling nauseous or sick to your stomach, take a suppository or pill. Commonly used medications include Zofran, Phenergan, Ativan, or Compazine. Ask your doctor for a prescription. Imodium AD or Pepto-Bismol may help control diarrhea. If this persists more than 1 day, call your doctor. Laxatives such as milk of magnesia and Dulcolax are okay. Stool softeners such as Synacot, Colace, or Metamucil are fine if pain medications cause constipation. Drink lots of water and eat high-fiber foods such as whole grain breads, vegetables, and bran. Mouth sores and oral hygiene. Chemo can affect the mouth and cause inflammation or soreness. Patients should examine his or her mouth at least once daily and report soreness or changes to your doctor. Keep your mouth clean and moist. Perform the following steps within 30 minutes of each meal and at bedtime. Swish with a salt, soda, and water solution in your mouth and rinse. Avoid chloroseptic. Floss at least once daily. Discontinue if pain or bleeding occurs. Brush your teeth with a soft or foam toothbrush with baking soda. Dip the toothbrush in hot water before brushing to soften the bristles. Rinse with salt or soda solution. Use Ulcerise to soothe and a topical oral antibiotic if ordered by your doctor. Keep your lips moist with chapstick, cocoa butter, or petroleum jelly. For those with dentures, clean as you normally would. Rinse with water. Soak your dentures in denture cleaner. Rinse as normal, and place your dentures in clean water while not in use. If you experience tenderness, burning, or sores in your mouth, avoid foods that are hot, spicy, tomato sauces, or citrus juices. If a whitish plaque appears in your tongue or in your mouth, call your doctor. Eat a diet high in protein and foods that require chewing to promote circulation to your gums. Skin changes. Some chemo may affect the skin cells, which can result in dryness. Sexuality changes. There is no reason not to continue a normal sexual relationship while undergoing chemotherapy. However, sometimes the desire is low during chemo, but it will return after treatment ends. You, the patient, will determine your activity level based on the way you are feeling. Chemo can affect hormone cells in females that cause hot flashes and sometimes vaginal dryness, for which non-steroidal creams such as Replens may be used. In addition, females may experience a cease in menstrual periods. Pregnancy and fertility concerns. Most chemo can cause birth defects if pregnancy begins during treatment. Ask your doctor about birth control recommendations. Some chemo can also cause problems with fertility, even after treatment concludes. Talk with your doctor about whether you may want to have more children in the future while you are planning your treatment. Pain. Don't tolerate uncontrolled pain. Depending on the drug, pain medication may be taken every 3 to 4 hours. If you feel more than 6 to 8 pills per day are needed, your doctor may want to prescribe something different. You may take a short-acting pain medication at the same time as a long-acting one. Take it as soon as your pain starts. But because these tend to cause constipation, stool softeners such as Senokot, Colace, or Metamucil should be used in conjunction. Activity level changes. Activity should be guided by you and the way you feel. Feeling tired and fatigued is normal, so extra rest is important. Avoid exposure to the sun. You may ask your family or friends to help with cooking, chores, and responsibilities that you might not feel the energy to perform.
In most cases, a healthy diet can help improve the treatment process. Even doing simple things such as incorporating 5 or 6 smaller meals throughout the course of a day can make a difference and make your treatment experience a lot better. Making sure that you have adequate amounts of protein in your diet is important, as well as adequate hydration. Adding a multivitamin to your diet as well can be very beneficial. Some foods may produce a bitter taste during your treatment. Marinating your foods in things like fruit juices or in soy sauce can help improve that flavor. Also, using plastic utensils instead of metal utensils can also help reduce that bitter taste. If you experience any soreness or mouth discomfort, avoiding things like spicy foods, citrus juices, and also maybe tomato products can help your mouth feel better and avoid some of the side effects. Limit foods that typically cause gas, such as sweet potatoes, beans, or cabbage. Avoid drinking alcohol. Supplements such as Ensure or Boost are permissible and can be helpful.
Refills are routinely filled by requesting during normal business hours. Sudafed is permissible for cold symptoms. Laxatives or anti-diarrhea products are permissible. Imodium AD or Pepto-Bismol may help control diarrhea. If this persists more than 1 day, call your doctor. Laxatives such as milk of magnesia and Dulcolax are okay. Stool softeners such as Senokot, Colace, or Metamucil are fine if pain medications cause constipation. For nausea, ask your doctor for a Zofran, Phenergan, Ativan, or Compazine prescription. Avoid taking Tylenol for temperatures above 99 degrees. Low-grade temperatures should not be suppressed. Avoid aspirin or aspirin products. There are certain circumstances that require a phone call to your doctor. A temperature of 101 degrees or more, mouth changes or sores, bleeding gums, blood in urine or stool, diarrhea lasting more than 24 hours that is unresponsive to medication, uncontrolled pain.
I'm Sandy Bizet. I'm a medical social worker here at the clinic. My job and my role here is to provide emotional support for people just diagnosed with cancer going through the adjustment of that diagnosis as well as through the adjustment to treatment, and to provide resources. Those could be educational resources about their disease, ways that would help them cope with the disease and the treatment, as well as financial resources that they may need. Patients often are overwhelmed when they're first diagnosed. They don't know what to expect. They often didn't even know what an oncologist was before they were diagnosed. We're here to provide support and education for them and to address any concerns that they have about the side effects that they're having. As a cancer survivor and chemotherapy survivor myself, I know it's not always as easy as we make it sound. Most people think that chemotherapy after the fact is not nearly as scary as they originally thought it would be.
Your doctors and your nurses can help you with questions and worries about your treatment, but the social workers are the experts in helping you express, understand, and cope with the emotions cancer treatment can bring about. Depending on your specific needs, our team of caregivers can connect you with the professionals and resources that help you address concerns, such as financial assistance, insurance assistance, transportation to and from your treatment, psychotherapy, spiritual counseling, and support groups. Keep your treatment goals in mind. A positive attitude will go a long way. Eat a healthy diet. Your body needs this to rebuild tissue and regain strength. Learn as much as you're comfortable with about your diagnosis. Knowledge about your disease can often lessen fear of the unknown. Visit the Baton Rouge General, American Cancer Society, or the National Cancer Institute websites for reliable information. Keep a journal or diary during your treatment to track your thoughts, activities, and questions you might have for your doctor or nurse as you go along. Focus on what is important. Let the small stuff slide, and focus on the people and activities in your life that make you the happiest. Try new hobbies and learn new skills. Exercise if your doctor approves and when you have the energy. You can elevate your self-esteem, build your energy level, rid tension, and improve your appetite.
Remember that every patient is unique in how he or she responds to chemotherapy. Do not anticipate having any side effects. Many patients are pleasantly surprised at how well they feel throughout their treatments. Please keep this information close and refer back to it as often as you like. Don't ever hesitate to talk with your doctors or nurses about any concerns you're having. We're dedicated to holding your hand throughout this journey, every step of the way. I'm Dr. Gerald Militella. On behalf of our staff at the Hematology Oncology Clinic and the Pennington Cancer Center, we wish you well. We're here when you need us.